Welcome to this explainer. Today, we are diving straight into a massive, high-stakes environmental and medical investigation. We're going to decode an invisible landscape. Specifically, we're looking at PM2.5 and its absolutely severe impact on public health in central Bangladesh. If you've ever wondered how scientists track an enemy that floats right in front of us, completely unseen, well, you're in the right place. Every breath we take connects us to our environment, and today we're uncovering what happens when that environment turns hostile. We've got some really incredible data to get through, so let's just jump right in.
234,000. Take a second to just let that number sink in. That is the staggering amount of premature deaths linked annually to PM2.5 in Bangladesh alone. We're talking about roughly 3.5% of all fatalities worldwide stemming from this one single issue. So, to be clear, we aren't just talking about a little bit of smog or a hazy skyline here. We're dealing with the lethal, massive scale of a systemic public health crisis that is silently claiming millions of lives year after year.
And you can really see the epicenter of this when we look at the glowing economic engine of Dhaka and its surrounding districts. It's this rapidly urbanizing hub housing over 22 million people, right? Tens of thousands of industries driving massive economic growth, but it carries a massive hidden atmospheric cost. The reality on the ground is harsh. The mean atmospheric PM2.5 concentration here ranges from 65 to 67 micrograms per cubic meter. That literally shatters the safe limits set by the World Health Organization. It exceeds them by an alarming 8 times.
And the crazy part is, this isn't just some sudden, unfortunate weather anomaly. We are tracking a 17-year escalation of atmospheric toxicity. Since 2002, the annual mean PM2.5 concentration has spiked by 41%. It has essentially moved in lockstep with unregulated industrial and urban expansion. So what we're really looking at isn't a fluke. It's a relentlessly building, long-term threat that has been compounding year after year.
Section 1. The Environmental Intelligence Engine. Investigating the invisible.
So how exactly do you fight something you can't even see? Well, you have to build a technological detective. To truly understand the architecture of this crisis, researchers knew they couldn't just rely on one isolated source of information. They built this massive intelligence engine relying on 3 vital layers of data capture. First, space, pulling 17 years of continuous NASA and ESA satellite data. Second, ground, painstakingly collecting chemical samples across 28 different sites to analyze the exact elemental makeup of road dust. And third, human, critical health data pulled directly from 60 hospitals layered with deep socio-economic surveys. By merging space, ground, and human data, we get this unprecedented multi-dimensional view. We aren't just guessing anymore.
And here's where it gets really sci-fi. By feeding 14 distinct variables into supervised machine learning algorithms, we've actually moved from just reacting to pollution to forecasting it. We can predict these acute pollution crises with astonishing accuracy, achieving an R-squared value of 0.96. That is near perfect. We essentially have the computational technology to see the future of the air before a single breath is even taken.
Section 2. The crime scene. The 4-layer trap.
Now, air pollution doesn't just spread out evenly and dissipate into the sky. It gets synergistically trapped. We've got 2 powerful forces at play here. On one side, natural determinants, like high land surface temperature and stagnant water vapor act as massive aggravators. On the other side, human determinants, think incredibly dense road networks and skyrocketing population density, pull the trigger. The data proves a pretty stark environmental inequality. Pollution pools heavily in low-elevation, low-income urban zones that are just completely devoid of green space.
Let's break down how this physically builds in the environment, because the architecture of this crisis is literally a 4-layer trap. At the very bottom, you have geography, which basically acts as the bowl holding everything in. Above that, the winter meteorology forms this dense lid. Then we pump in the gas through massive daily emissions, and sitting right at the top are the victims, forced by socioeconomics to live right at the epicenter. When these 4 layers stack up, they create these incredibly lethal, inescapable microclimates.
And that's exactly why we see pollution pooling in very distinct geographic hotspots. These extreme red zones aren't random. Places like Ghazipur, which is a bustling manufacturing hub, and Narayanjan, an intense industrial center. These are the exact spots where this 4-layer trap locks in the absolute highest, most dangerous concentrations of PM2.5. Human activity, combined with the environment, has basically built a perfect storm.
Section 3. Unmasking the lethal culprit.
Okay, so we've mapped the crime scene, but I want to pause here and ask you to really think about this.
What do you think is actually the deadliest source of pollution doing the most damage inside these trapped zones? If you picture urban smog, you probably assume the primary murder weapon is thick smoke billowing out of industrial factory smokestacks, right?
Well, here is the huge dramatic twist of this entire investigation. The deadliest source? It's actually aerodynamic road dust.
If we compare volume versus lethality, things get really interesting. Yes, industrial brick kilns produce a massive, undeniable volume of PM2.5. But when we look at lethality, aerodynamic road dust, which is being churned up constantly by thousands of vehicles, carries severe carcinogenic payloads. Focusing solely on factory smoke completely ignores the most highly toxic threat, which is hiding literally right beneath our feet on the streets.
To understand why this road dust is so exceptionally lethal, we need a quick biology lesson. Think of PM2.5 as a microscopic Trojan horse. These particles are so incredibly small, less than 2.5 micrometers, that our body's natural defense mechanisms in the nose and throat completely miss them. They travel deep into the lungs, and because they are carrying toxic heavy metals from that agitated road dust, they cross straight over the blood-brain and cardiovascular barriers. This isn't just a simple cough. It triggers catastrophic systemic failure throughout the body.
And what exactly is hiding inside that Trojan horse? Heavy hitters like arsenic and nickel. Out of 17 analyzed elements, these specific heavy metals found in the road dust have a massive, mathematically proven correlation with spikes in infant mortality and acute respiratory infections. It's a heavy metal cocktail, and people are breathing it in every single day.
Let's ground this forensic data back in human reality for a second. We are talking about highly vulnerable populations trapped squarely inside these extreme red zones. This includes over 1.2 million pregnant women, which is 5% of the total pregnant population there, plus over 965,000 children aged 0 to 9. These are real people, millions of them, actively breathing in this highly toxic, heavy metal-laden air.
Section 4, the path to precision policy. But look, there is hope. Having unmasked the killer, we actually have the blueprint to stop it. Though before we implement solutions, we really have to understand the sheer urgency here. This crisis acts as a lethal multiplier. Damaged respiratory systems drastically increase susceptibility to severe viral outcomes, complicating public health during outbreaks like COVID-19. Furthermore, it creates a devastating economic bleed. Families in these hotspots are forced into a continuous cycle of poverty through acute out-of-pocket healthcare costs and missed working days. It's a vicious cycle.
Thankfully, we now have the exact, actionable interventions required. We don't need to guess anymore. We need geographic triage, deploying targeted emergency air scrubbing directly into mapped red zones. We need targeted source regulation, meaning we shift our focus to the widespread mechanization of road dust sweeping rather than just looking at factory emissions. And, absolutely crucial, we need to mandate green space integration to break that stagnant bowl effect in low-income urban zones.
Ultimately, by combining satellite intelligence with advanced chemical profiling, the invisible landscape is now fully visible to us. Broad, national-level guesswork, that is officially obsolete. Precision policy, targeting the exact intersections of toxic road dust, winter meteorology, and vulnerable demographics, is the absolute only path forward to resolving this.
So I'll leave you with this final, provocative thought. Now that the invisible killer is completely visible, will we implement the precision policy required to clear the air, or will we simply let the dust settle on millions of lives? The data is definitively clear. The blueprint for survival is quite literally in our hands, and the next steps are completely up to us. Thank you so much for joining me on this explainer. Keep asking questions and keep exploring the data.